TPS is a very interesting new CE-approved neuromodulation treatment where you give short impulses of pressure into the skull, into the brain. And there are some animal data showing that there are numerous things happen in the brain, from changing in the vascularization, NO, BDNF and things like that change. And there is a trial from Austria that showed in a number of patients that you can indeed improve cognitive scores with stimulation over a range of weeks if you repeat it over different areas of the brain. But the results yet are not placebo-controlled. These results are running at the moment in Vienna. So we are curious how the results will look like then. What we provide in our talk, in our session, is our first real-world data from the first German study. This is still retrospective data after TPS, transcranial pulse stimulation, and we found also some very astonishing effects on cognitive improvement in our patients. That was a pilot study, so on this conference we present the first 11 patients stimulated with the protocol, 6 stimulations over 2 weeks. And we looked for some cognitive scores, the ADAS score, the ADAS-Cog score, also for depression scores and also self-rating scores. What we found is that all patients showed kind of improvement either by the caregiver notes or in our cognitive scores. The mean improvement was around 18%. And it was significant compared before and after treatment in the ADAS and the ADAS-Cog score. The best improvement in one patient was 40% on the score, so there is a whole range of improvement changes. What is maybe new compared to the study in Austria is that we also investigated severely affected patients, and we looked whether moderate to severe patients compared to mild patients would improve more. And at the part of the analysis we do at the moment, we think that even or at best the moderate to severe patients improved more in the cognitive scores. That is very astonishing. We need more data. We need bigger groups to do some subgroup analysis, including CSF markers. We are working on EEG, electrophysiological markers. I didn't mention that yet. So we do EEG recordings before and after stimulation and find out how the electrical network communication changes after stimulation. We found some interesting candidates for biomarkers in terms of high-frequency oscillations, in terms of cross-frequency coupling. That means coupling between lower brain waves in a slower range, coupling to high oscillatory range in the gamma range over different brain networks. That could be a candidate for a biomarker to track treatment changes, but maybe also to detect before you stimulate which patients have a good brain signature to stimulate. If we come back to the methods I presented now, of course the first big step is to prove in a randomized prospective trial that our findings, our clinical findings, are superior to placebo. Of course, 70% main change could be also hard to compare to placebo. This is the first step to really prove that the treatment we now exploratively investigated has really an effect, a clinical effect. And as soon as we can find that, I hope we can find that, we can discuss more which network should be stimulated where, in which combination, how much should be stimulated at that area, at that time point, and so on. So there are lots of research questions opened, and we have lots to do.